The main reason I went into medicine was because of a great inspiration from my grandfather. And he was a great gentleman and a great physician, and really taught me a lot about caring and taking care of patients. And he practiced in a small village, but was trained in a big city. He was trained in Michigan in the early 60s, but went back to India to train, and he really inspired me to go into medicine. My philosophy of care is to treat patients as if they're close family members, and I would want the best for them. When they're done meeting with me, I want them to feel extremely confident in my abilities and my ability to take care of them, knowing that I'll provide the best service. I also want them to know that I will try to explain things in the smallest, simplest manner, so things are understandable and they know exactly what they're facing. It's quite scary facing open heart surgery, so my job is to make it simple, understandable, and feel like you're in good, safe hands. The one thing I find most rewarding about my work is seeing how patients' health immediately improves. Oftentimes we're dealing with a lot of life-threatening emergencies that can be quite overwhelming for the patient and their family, but to pull a patient out of the fire and make them whole and make them better, there's no better feeling than that. In addition, what I also love about being in the hospital is just working with a great team that really become your family outside of your home, and you work day in, day out with them, and having that collaboration is really satisfying. I've been a cardiothoracic surgeon for the last 23 years. It's been a tremendous honor and opportunity to be able to take care of patients' hearts. The field has really changed dramatically from the time I graduated till now. We're doing things that we never would have thought of 20 years ago, and that's been quite an amazing evolution.